My name is Jennifer White, and I am a licensed practical nurse in the baccalaureate program at Indiana State University. This is my sixth and final health education project in the spring of 2021 for Community Health Nursing Class 444. I will be discussing asthma. By the end of this presentation, the participant will be able to 1. Define asthma, 2. Discuss the causes of asthma, 3. Recognize the diagnostic criteria common with asthma, and finally, summarize the treatment of asthma. Please pause the video here and take the pretest listed in the comments below. According to Quirt et al. 2018, asthma is a respiratory condition that affects more than 25 million people in the United States, including 1 in 10 children. This respiratory condition is a chronic inflammatory process that decreases airways in the patient. This is caused by the swelling and narrowing of the airways that can be detrimental to the person's oxygenation status. Asthma can cause patients to feel short of breath, chest tightness, and may present with audible wheezing that is caused by the passage of air through the narrow airways. Patients may experience asthma differently. Some may only have symptoms occasionally when exposed to a trigger. Others may have constant difficulty breathing, despite avoiding all triggers. Asthma attacks are a life-threatening condition and should be addressed by medical professionals as soon as possible to ensure that respiration and oxygenation are assisted when needed. These attacks can be reversed either spontaneously or with the use of multiple medications. Asthma has many triggers, and they are all associated with T helper cell response to immunologic stresses. When T helper cells increase, they mediate the release of interleukin and other cytokines that in turn initiate the release of histamine, which causes bronchospasms and is indicated by the characteristic symptoms of asthma to include wheezing, chest tightness, and shortness of breath. The exact cause of asthma is unknown, but may be a combination of many areas. This includes a family history of asthma, early childhood viral respiratory infections, and exposure to environmental toxins. These toxins can include cigarette smoking by the mother during and after pregnancy, exposure to dust and pollen, and pollution. Exercise and exposure to cold air can also cause an asthma attack. A complete history and physical assessment should be conducted on the patient after stabilizing their respiratory status. Since there is a genetic link between children and the development of asthma, more studies need to be done in the area of genetics to help healthcare professionals diagnose and treat asthma. The patient's lung function should be assessed using spirometry both before and after medication administration. Airway inflammation tests can be performed to measure the number of eosinophils during inflammation. Other tests can include a chest x-ray, a sweat test to rule out cystic fibrosis, and drawing vitamin D levels, since many children diagnosed with asthma have shown to have decreased levels of vitamin D. Scotney and Saglani, 2020. An allergy skin test should also be performed to identify allergens that may trigger asthma attacks. Asthma can present in many levels of intensity. If the symptoms are mild and respirations are not overly burdened, the asthma attack may end spontaneously. For more severe symptoms or asthma attacks that occur regularly, medications will be prescribed. These medications include inhalers, such as albuterol, which is a rapid-acting beta antagonist that relaxes the muscles around the airways and allows them to open again. Children must be taught early the correct way to use inhalers to prevent the improper use and possible abuse of inhalers. Oral medications are also given to manage the effects of asthma after the attack has been reversed. In severe cases of asthma, the patient may need to be admitted to an intensive care unit and placed on a mechanical ventilator until the underlying cause of the attack has been addressed. The most effective treatment for asthma is for the patient to avoid anything that may trigger the attack. This includes avoiding cigarette smoke, dust, pet dander, and environmental pollution, and to exercise with caution. It must be stressed again that asthma patients must avoid cigarette smoke, including secondhand smoke, to help prevent the symptoms of asthma. The goal in the management of asthma is to recognize and prevent exacerbations of the disease process, according to Court et al., 2018.